I want to welcome everybody to the Resident and Family Support Council that we hold on the second and the fourth Tuesday of every month. And we do these meetings to empower people with information. That's our purpose here, is so that people can be able to navigate the long-term care system in Illinois in a better manner. And so these meetings are really important. If you ever miss a meeting, I know you saw some of those opening slides beforehand that share. We do have a YouTube page where all of these get recorded and they're placed onto there. And a lot of people go back to those. The topic that we talk about today might not be pertinent to you, but then a couple of months from now, it may be. So we want to make sure that everybody's aware that you can always go back and listen to these topics on the YouTube page. And I believe Stephen is going to probably start putting this stuff into the chat. I'm not seeing Stephen on yet. If he doesn't do it, we'll go ahead and we'll make sure that that happens so that everybody can access that information. And then also I want to tell everybody we're also on YouTube. That's another way to connect right through these meetings, is you can go onto YouTube and you can onto Facebook on the day of the event. And we always have the link is put right up on that. So you can go right through Facebook, click on the link, and it'll bring you right to the meeting. So always know if you can't find the invite for some reason that you can access it that way. And then lastly, if you want to get put on the invite list, please feel free, email me, put your email in the chat. I can do it that way. We just want to make sure that this information gets to the people that need to be hearing this information. Because a lot of really important information gets shared during these meetings, such as today's topic. We're really excited to have today's topic. We've got the team from Telligent here. Telligent actually is the Quality Innovations Network Quality Improvement Organization for the state of Illinois, as well as for Iowa. And Iowa, Colorado, Oklahoma. And they provide nursing homes with free technical assistance to improve the nursing home quality, which we all know is very important and really needed. Carolyn Dutton, actually, hey, Carolyn, she's going to be leading this conversation today and demonstrating to us about Care Compare, which is a fantastic site to be able to really understand how you can make some empowered decisions when it comes to long-term care. Carolyn is actually the Senior Quality Improvement Facilitator for Telligent, and she's a registered nurse, as well as a licensed nursing home administrator with 30 years of experience in long-term care. And Carolyn, I think you're going to go ahead and introduce your other teammates who also have joined us here today.
Yes, thank you, Lee. My name is Carolyn Dutton, and as she said, I am a Senior Quality Improvement Facilitator for Telligent, and we do provide technical assistance to nursing homes free of charge, and our goal is to improve quality of care in the facilities. I have with me today some of my teammates, Nell Griffin, Sarah Friel, and Lisa Bridwell, and she may not be on yet, but I think she's going to be joining us shortly, and they will be assisting in answering your questions today. So
Wonderful.
if it's okay, Lee, I'm going to go ahead and share my screen, and we are going to be talking about Care Compare, and there is a lot of information. So I think it would be easier if we just go through and I show you the website and we go through some of the different aspects of it. So give me just a moment here, and I will share my screen with you. If I can see my other screen. I have 3 screens going here, so please be patient with me.
Oh, that's okay. We get used to being patient with all of this technology. You know,
I know.
Be jumping all over the place on us.
Right. It's great when it works, right?
Absolutely.
That's what they say. So today we are going to be, can you see my screen?
Yep, we can.
Oh, okay, great. So you should be seeing the Medicare.gov website, and we're going to be looking at Care Compare. And Care Compare was created for people with Medicare or their caregivers who want to choose a Medicare provider, and it lets you find more information about facilities based on your individual needs. And it will help you get helpful resources and help you choose a facility and make more informed decisions about where you get your health care. So one important thing that I want to mention is this is not meant to replace going to the nursing home itself, but it gives you information about the facility to further prepare you for your visit.
And
So
I'm noticing, Carolyn, that it's a .gov site. So
yes,
Medicare, so this is coming right from Medicare directly?
yes, right from Medicare directly. Yes,
That's
yes.
wonderful. That's
And
important to know.
very important. So all of this information is accurate, and there are a lot of complex processes that goes into this. So, and we'll go into a little bit of that, but this is going to kind of be a high overview of it to give you an idea of what to look for if you are choosing a facility for yourself or a loved one. So when we go to the Medicare.gov, this is the easiest way to find it. Go here, but we're going to go over on this toolbar to the right to providers and services, and we're going to click on this arrow, and then we're going to scroll over to find and compare and find care providers. Now, this is actually going to take us to the actual Care Compare website where we're going to be able to compare the nursing homes. So as we scroll down, you'll see the welcome here, and it talks about using this tool to find different types of Medicare providers. But today we're going to focus on nursing homes and rehab services, although you are able to compare hospitals and clinicians and home health and all kinds of different things. But
Oh, that's
before we get
great.
to,
Yeah,
yeah,
that's great, Carolyn. That's wonderful that it's not just for nursing homes. So all of these different entities. And I love it that I'm feeling more safe and secure because it's a .gov. It's not somebody putting out their own opinion. It's
exactly.
actual information.
Anytime you see that .gov, you're going to know it is an official site. It's the information and the data there is official data and information. So it's always good to look for that. But before we start, I would like to scroll down just a little bit, and I want you to look at the bottom of the page here where it says more resources and about this tool. And as I said, this is kind of complicated. There's a lot of different factors that go into this 5-star rating. So the 5-star rating of a nursing home or a facility is not like a 5-star you would expect from a hotel when you're looking at something like that. There are different things such as their health inspections, their staffing, their quality measures that go into that. And this is going to give you more information about utilizing the 5-star tool, the Care Compare tool, and a 5-star, and using the government data that is there for you. And as you see, there's a lot of, and you're going to see this all over the website, there's a lot of blue text here that's underlined, and these are links, and it's going to take you to different places and different resources that's still going to be a part of the government and the government website, and it is going to give you more information on how to use this site. So as I said, this is going to be, because there's so much involved, this will be kind of quick overview, not really as in-depth as we could go, but it's I think it's going to give you a good idea of what to look for when you're using this site. Another thing that I really want you to focus on is down here under resources and information. And when we click on this, it's going to take us to a page, and it's going to give you some options for doctors, hospitals, nursing homes. But we're going to look at the nursing home section. And there's going to be some links here with some resources for you when you're choosing a nursing home. And one of the first things, there's a couple of things I really want to focus on. We won't go into all of these because we just don't have time. But this one that says view a checklist of things to ask and to look for when visiting a nursing home. So I just want to click on that really quick and show you this document here. Now, this is something that you can print out, and you can take this to the facility with you. But not only can you do that, when you are looking and comparing facilities on the Care Compare website, you can look at these questions. This has got the information that you really want to find out when you go to visit the facility, or when you're looking at the different homes on Care Compare. And it gives you questions to ask, yes or no, and some places over here to write your notes. That's also a good space to write questions as you go through the Care Compare website, that you can look at and say, oh, I have a question about that. So when I go visit, I want to be sure and ask them that. And you can put those notes here, and it will be a good refresher for you when you do go to the facility, that if there's something that you want to ask more about. But I want to scroll down just a little bit, and I want to focus on this box right here, the basic information. Will the nursing home tell me in writing about their services, charges, and fees before I move into the home? And there's a note here that says Medicare and or Medicaid certified nursing homes must tell you this information in writing. And it tells you to get a copy of the fee schedule to find out which services are available and which are included in your monthly fee and which services cost extra. And then compare that when you compare nursing homes. The reason I wanted to point this out is now there are a lot of different Medicare Advantage plans that are managed by other insurance companies, the same as with Medicaid, and not all nursing homes have contracts with all insurance companies. So you want to make sure whenever you go that you do check with them and make sure that you do have coverage and what is going to be covered by your insurance, your Medicare, your Medicaid, and what is not. And that way you don't have any surprises.
Oh, that seems like a really important question to be asked.
Very, very important. So there's no surprises whenever you get a bill later on. I also want to scroll down here under safety and care and look at the second box here. It says, is the nursing home taking action to improve quality or staffing as needed? So when you go to the facility, ask that facility, are they working with Telegen? As we said earlier, Telegen, we are a quality improvement organization, and we work to help improve quality in nursing homes. So it's really good if they're working with us. We're helping them to improve the care that they're giving in those facilities. So that's something you want to ask them. Are you working with Telegen, and what are you doing to improve the quality in your facility and to improve the staffing? So that's something kind of important I wanted to point out. But this is a really great checklist. I won't go through all of it. You can look through it, but it goes through different sections. I won't scroll too much because I don't want to make anyone dizzy or sick doing that. But it goes through all the different sections to staffing, activities, the resident rooms, different things that you really want to look at and focus on when you go to that facility.
We have a lot of worker bees working in the background, and I would encourage for them to find the Telegen link and make sure that gets into our chat so that people can access the Telegen link.
Yes, absolutely. That is, and like I said, we are free of charge. We are non-regulatory. We're not going to go into facilities and give them citations or tags or anything like that. We're just there to help. And as I said, we are at no cost to that facility.
Well, it sounds like something facilities really should be taking advantage of.
Absolutely, absolutely, yes.
Nowadays, yeah,
it is such a good. Yes, and it's a good resource for the facilities. We have lots of good resources and information that we can give them, and lots of help that we can offer to those facilities.
Wonderful.
So going back to this page, down below the links is a section on nursing home resident rights, and that's really important as well. You want to know what those resident rights are, what your rights are or your loved one's rights are when you go to that facility. These are really, really important to know. And there's a link here that can tell you more about that. Every resident that's in a nursing home has rights, so that's really important to know that you have that. Also, how to file
the commercial one for the ombudsman program now.
Yes, ma'am.
Any of those rights are being violated, call your ombudsman. And I know Stephen's putting that information has put that information in the chat as well on how you can get in contact with your ombudsman if you feel like your rights are not being listened to.
Absolutely. I tell people all the time, or I did whenever I was an administrator and a director of nursing, the ombudsman, they're available for the resident. They are the resident advocate, and they are there to advocate for them. And so they're a wonderful resource to the resident and to the facilities as well. So as we scroll down, so that hopefully you don't have to use this part, how to file a complaint or to find a state agency. And this section is going to tell you when you should file a complaint, how to file it, the state websites with the information of how to contact those state agencies. If you show more, it's gonna show you the rest of the states. We're not going to take time for that. But then also down here is some more helpful websites and publications. So this website is not just about comparing nursing homes and looking at their 5-star ratings. There is a lot of useful tools and information that you can obtain through this website. So I'm
Wonderful.
going to scroll back up here and go back. And let's start looking at comparing some facilities.
Okay.
So over here to the left, we're going to see nursing homes, including rehab services, and we're going to click on that. It's going to pull up this screen over here, and you'll see my location and a little asterisk there. And that asterisk means that that is uh, necessary. You have to put that in. That's a required field you have to put in. You have to put in where you're going to be searching for a facility at. Now, over here to the right is the name of the facility, which is optional. So if you wish, you can choose a specific facility. If there's one that you know that you want to look at, you can put the name of that facility in, and it will pull that particular facility up for you. But today we're going to look at some different ones, and we're going to do some comparisons. So for comparison, I'm going to put in, because there's a lot of different homes here in this area, and we can do some good comparisons, is I'm going to look at Chicago Heights. Now, when you start to put in a location, it's going to pull up some different addresses and things, and you can just click on that, or you can go ahead and type it out. As I said, you can enter the name of that facility if you wish, but we're just going to search the Chicago Heights area. And that is going to bring us here to this page where we're going to compare the nursing homes. Now, when you land on this page, you're going to see your location, your provider type, which we are looking at nursing homes, but there's also the different services that we saw on that first page as well. And then again, the option to put a facility name in here if you're searching for a specific facility. So there's lots of ways to look and filter for things. Now, also, you have the option to filter by distance, anywhere from 5 miles within that location to 200 miles. So you've got a good range there where you can look for facilities. If you want something closer to where you're looking for, you can make it closer to home, or if you're okay with driving a little ways, then you can go up to 200 miles.
And that's interesting. I was involved in a conversation today with somebody else, and they were saying sometimes the location of the long-term care facility can be very important, because you have to take into account how comfortable you are in driving, and if it's driving
Yes.
in the dark, going to see your loved one, what does that feel like? So that can be really important. And I love the fact that there's a map there, so I could see exactly where I live and see how far, what might be
Yes.
closest. That's a very good, that's wonderful that we can see that as well. That's important.
Yes, and absolutely. And as we look over here at this map, I was going to go over this in a minute, but since you brought it up, whenever you have your cursor here in this block, it's gonna highlight where exactly that is on this map, and it gives you a better idea. These two are pretty close together, and these are listed according to distance, closest to farthest. But we can also change this, and we can sort it by the highest rated. So if you want to sort and look at only the 5-star facilities and you want to start with that, you can do that. But today, for our purposes, we are going to go with the closest. Also up here, I wanted to point out on the filters that you can filter by overall rating. So if you want to only look at facilities that are a 5-star, you can click that, and it will show you only facilities that are 5-star. If you want to look at 3-star and above, you can click those, and it will show you those facilities as well. Other ratings. Now, this is going to pull up all of those ratings that go into the overall 5-star, which is the health inspection, and you can filter according to the star rating of the health inspections, the staffing, and the quality measures. And then there is a box over here that will show you all the filters, and you can just come over here and you can just do all of those at one time. It gives you the distance, the overall rating, the health inspections, the staffing, the quality measures. This also gives you the number of certified beds. So if you're looking to maybe put your loved one in a smaller facility, maybe that's a little more intimate and small. You can go with less than 50 beds and all the way up to more than 200 beds. So you have options there. And then as we scroll down, you can click even more filters that to make sure they accept Medicare and Medicaid. And if they are within a continuing care retirement community, because some people are looking for something like that, or if they're within a hospital, because there are facilities that are attached or located to hospitals. So those are all different filters you can use whenever you are looking at comparing these different facilities. So, I'm sorry, go ahead.
Since you're on the page, we had a question come up. Why are some facilities not rated or no rating available?
Well, there can be a couple of reasons for that. Some of them do not have enough data that they are able to rate those facilities. Some of them focus on short stay residents and trying to get those rehab to home people that are there for just a little while, and they may not have enough information or enough data for them to have information on the Care Compare website. Another thing is that I wanted to show you is here, if you see this triangle with an exclamation point, it says this facility is not rated due to a history of serious quality issues. The nursing home is subject to more frequent inspections, escalating penalties, and potential termination from Medicare and Medicaid as a part of the special focus facility program. Now, they will not have data available. And if you see that where there is not data available on the website, usually there is a number like this. And if you hover over that, it is going to tell you why that data is not available. And again, it talks about this being a special focus facility. Now, those special focus facilities have more frequent health inspections. I believe those are usually every 6 months. They have penalties, and they're watched just a little more closely. Now, that being said, that information, that you're looking for, you can go to the facility or contact the facility to obtain that information. So just because it's not on the website doesn't mean that they shouldn't be able to give you the information that you're looking for. Does that answer the question?
I believe so.
Okay.
And I think that's important to be aware of, is that that triangle, because that gives us a lot of very good information. Those special focus facilities are those facilities that get on that list.
Yes, they do.
Because
yes.
they're not performing very well. So if I don't know if I'd want to send my loved one to, or go personally myself, go to a community that is designated as a special focused building. So it's great that they really put that out there for us to be fully aware.
Absolutely, absolutely. And as you said, there is a list, and they have to perform well. They have to improve their performance and to be able to get off of that list. So that is something that you'll want to look at as well. Another thing I wanted.
We had the
Go
link
ahead.
put in. We had the link to the special focus facilities was put into the chat by somebody. I just saw
fantastic. That's fantastic. Also, I wanted to point out here, when you're looking at these facilities, again, it's going to filter them starting with the closest down. It's also going to show you if they have had an abuse citation. Now, when we hover over, we looked at this red circle with the hand in it. It says this nursing home has been cited for abuse. And for more information, follow the consumer alert link at the bottom of the page. So I want to go over that just a little bit as well, because I think that's important, because as you can see, as we're scrolling down, there are several here that we're passing as we get to the bottom of the page. And I'm trying not to scroll too fast because I don't want to make anyone sick. But here at the bottom is the consumer alert, and it says that nursing homes that have been cited for potential issues related to abuse have the following icon next to their name. And it is that red dot that is going to cause you to stop and get attention. It has the hand in it, and it says, for more information about this, and what to do if you suspect abuse has occurred, it can be found here. And there's a link here. And this is going to talk to you about preventing abuse in nursing homes. Now, there's a couple of things I want to say about this. This is very important as well, because nobody wants their loved one to be abused or mistreated or be neglected in any way. But this isn't always meaning that this is from staff to resident that this occurred. Their staff's facilities can also be cited because of resident to resident altercations. Maybe two residents weren't getting along and they got into an altercation. Sometimes they have weak policies that just need to be better. Also, sometimes there's time constraints on when they report any allegations of abuse, and maybe they didn't report it in a timely manner. Excuse me, and that could lead to one of these citations where you would see this icon here. So I encourage you to look a little bit more into this if you are looking at a facility where you see this, because some people, you would think, well, why would someone put someone in a facility where they've had abuse, or they're a special focus facility? Well, sometimes it has to do, like you said, Lee, it's transportation, and they're not able to go a long distance to a facility, and they have to, look at what's closest. But you are able to look into these facilities closer and to see what those citations actually were that led to this abuse citation. So, and we'll talk a little bit more about that when we get over into the health inspection section of the 5-star and the Care Compare website. So that's something you want to dig a little bit deeper into. And again, if you feel that you or someone you know has been abused, please contact your state survey agency, and this is going to give you a link of how to do that and how to get a hold of them. Okay, so going back here, we're going to go over to, or back up to, if I can get my cursor back over here, back up to the top. And as you see over here on the right, this is going to give you the overall star rating. As you see, this one's not available because it's a special focus facility, but this one is a 2-star. And below that, it gives you the compare button. So this is what we're going to click on to start comparing facilities. So we're going to choose Brea of Chicago Heights. You'll also see this button over here, and this is to add to favorites. I just want you to know, though, in order to add that to a favorite, you have to register and be logged into this site in order to add that to a favorites list. So let's see if we can find a 5-star facility that we can compare. So I'm going to scroll down, and I'm going to go to the next page. And as you can see, there are lots and lots of facilities in this area within just a 25-mile radius. So let's see what we can find here as we scroll down. So here is a 5-star facility, Frankfurt Terrace. There's also one here. This is Park Place Health and Wellness. Let's do, that was a 3-star. And oops. Now I accidentally clicked on that, and I do this all the time, but it's okay. Whenever you do that, this is just going to take you to their main page, and it's going to give you all the information about this facility, and it's going to include their overall rating, their health inspection, their staffing, their quality measures, and we'll look a little more detailed into this in just a moment. Go back, and I'm going to click on the right thing, which is compare, and I'm also going to add Frankfurt Terrace. And that's going to bring all 3 of these facilities up here in this top toolbar, and we're going to hit compare. Now, this is going to show us the listing of facilities side by side, as well as that information about where they're located, their phone numbers, all of that. And then it's going to give you an overview. And you're going to be able to look at these side by side. So this is only 1.1 miles. This is 11.7. You can compare this. And then it's going to show you the overall star rating here. and I think I covered this earlier when we were talking about the star rating, but this overall star rating is not an average of all of the ratings. This is has a specific set of factors and determinants that go into determining that overall star rating. Now, that overall star rating begins with the health inspection and it goes from there. So when you're looking at this, don't be looking at, these and thinking that that's a average of the different domains there of the health inspections, the staffing, and the quality measures. But a lot of different things go into that as
And I
well.
also think what you said about, don't think about it like the hotel rating.
Yes,
I think that's an important thing
absolutely.
for us to remember.
Absolutely.
5 stars doesn't mean that it's a 5-star hotel.
Exactly. Right. Right. It does mean that they're performing well according to everything that they're submitting, but it does not mean they're a 5-star hotel. And in fact, only 10% of the facilities in each state receive a 5-star rating. So that's good to know as well. So if it is a 5-star facility, it is in the top 10% in the state. So does anyone have any questions about that overall rating? Do we have any questions on that before I move on?
Yeah, do feel free. You can either type them in the chat if you'd like, or you can unmute yourself.
Sure.
It's how you'd like to do it, but feel free, just interject. Carolyn's doing a great job allowing me to interject all the time. So thank you.
That's great. I love the conversation. I love the feedback. So,
So Karen posted in the chat that it's important to note that your search could pull up out of state facilities. So if you are living near the border, that is something very important to remember.
Absolutely. Yes. And actually, I did choose one that is in Indiana. So that's something also important to remember. But I'm just using this for a comparison to show you on one of the measures. But yeah, this will, if you are close to the border, it will pull up facilities in other states as well. So you kind of want to pay attention to that. The federal health regulations are all the same. The states may vary just a little bit, but
and with that being said, I also, though, like, let's, for example, if my mother lives in Arizona and she needs to go into a long-term care community, I could go to Arizona on this site and be able to
precisely
not just have to look in Illinois. This is all over the whole country.
Absolutely.
That can be extremely, or I need to help my aunt who lives in another state. I can help her by looking at this site. That's wonderful.
Yes, precisely. And it gives you a lot of good information here. It is a lot of information. It's a lot to digest, but it's a lot of good information that you can take and you can utilize. So let's go on down and let's look at health inspections here. And as you can see, it's comparing the 3 different facilities and their health inspection ratings. As well as their staffing ratings and their quality measure ratings. This is going to go to show you how many certified beds, how big the facility is, if they participate, in Medicare and Medicaid, if they're for profit or not for profit, their business name. And with this group, I think this is kind of important. If they have a resident and family council, if they have one or the other or both, if they're located within a hospital, automatic sprinkler, and then here is that section where you can add again to favorites if you're logged in. So when we click on health inspections here, it's going to pull up their health inspection rating. And I just want to talk about this briefly because all facilities, if they are Medicare and Medicaid certified, they must have an inspection at least once a year. In addition to an annual inspection, there is also complaint inspections that can take place. There is also infection control surveys that take place. So this is not just an annual health inspection. There's also other inspections that can figure into this health inspection rating. And those are all weighted a little bit differently. So what this looks back at is the last 3 years of health inspections. And that's what goes into this health inspection rating. And they're not all weighted the same. So there's a formula. And when we look here at, let me go to Park Place real quick and I'll show you briefly. When we go down here, we look on this, on the staffing, oops, I'm on the wrong one, doggone it, health inspection ratings. there's a link here under this section, and it says learn more about health inspection ratings, and it will give you more information about what goes into that, and what the citations, what those are, what's an informal dispute resolution process, and about complaints, what an infection control inspection is. Those are the ones that they do, and they check to make sure that hand hygiene is being performed correctly and at the right times, if they're using proper PPE, they have good emergency preparedness procedures, those kind of things. And then the general health inspection star rating, that calculation, how they calculate that. So this will give you more information on it. So there's a lot of factors that go into this, as I said, into those star ratings. It's not just from one inspection. Now, if we look at the different types of inspections briefly, there are 3 types of inspections. There is annual, which is an on-site inspection. Now, those are not pre-announced. The facility does not know when Illinois Department of Public Health will be coming in to survey them. So that happens at least annually. And then there are complaint surveys. Now, it's important to know that every complaint that comes into the state must be reviewed. So if someone calls in, whether it be a family member that calls in a complaint or an issue, or to a disgruntled employee that is upset and wants to try to get the facility in trouble, they have to look at every complaint that comes in. So every single complaint that comes in, you're going to see that. That doesn't necessarily mean they had a citation under those complaint sections, and that's why you want to look at that a little bit closer. But they do look at all of those complaints. If a complaint is called in, then IDPH will follow up on that, which is the Illinois Department of Public Health. So there's also infection control inspections, which we just talked about. And then also, in addition to that, in addition to state surveys, sometimes federal surveyors. These are surveyors that are not just for the state of Illinois. They are all over the nation, and they come in and do federal surveys as well. So those are some of the things that you could see. So as we scroll down, this is going to give you information to compare between the 3 facilities. It's going to give you the data, the most recent, and it's going to give you the option here to click on that and look at the full report. It's going to give you the total number of health citations that the facility received, and here it's going to tell you that lower is better, so you want to look for, lower number of citations. And it's also going to give you the average number of citations in the United States as well as in the state of Illinois. And if you see these dashed lines underneath this, if you hover over that, that's going to tell you a little bit more about it, that this is the total number of citations from the last 12 months of complaint and infection control, as well as the health inspection. So that's something you'll want to look at. This is going to give you a list of the complaint inspections, and this is from 2/1/22 to 1/31/23. And if we take a minute and we look at one of these inspections, I'm going to look at this one real quickly. It's going to pull up this document, and I'm going to make this a little bit bigger and hope you can see it. I don't know if that's big enough or not, but I don't want to get it too big because I won't be able to see. But this is actually the statement of deficiencies, and this is what is sent to the facilities when they do have a citation. And what you're going to look for over here to the left, remember we were talking about that abuse, and when they get those abuse tags, this is what you want to look for, not just in a complaint survey, but also in their annual surveys. If you see any number over here from F0600 to F0610, F0600 to F0610, those are all abuse tags, and that's what you want to look for. That means that there was some type of abuse that the facility was cited on. If you look over here to the right, this is going to talk to you about, this is going to give a summary of what happened and what those findings were when they investigated or when they did that survey. It's not going to give you the exact date. It's also not going to give you name of residence for confidentiality, but anywhere in this report you see an R, that's going to represent a resident in that facility. Anywhere where you would see a V, I'm not sure, there may be one on further down. There should be somewhere if I can see it and I don't. Here, V1. Anywhere you see a V, that is going to be a staff member. So there's a lot that is of information that's going to be here, but it's not going to give you anything that is going to breach privacy or HIPAA in that. And this is one of those that we were talking about earlier, one of those abuse that you want to look more into. Now, this was, it looks like it was a resident to resident because it looked like there were 2 residents involved. And when you look over here, it's also going to give you the level of harm. And as we can see, there was some actual harm that happened in this instance. And the number of residents that were affected were few. It looks like there was probably just an altercation between 2 residents there. So you'll want to look at those things. And again, when you're looking for those abuse tags, you're going to look for F600 through F610. That's gonna show you the abuse citations.
And on this, they only list the ones, not every, it wouldn't be every complaint or every issue. It would only be the ones that are cited that there was a finding for it, correct?
Yes, but sometimes you'll see on, I don't know if they do that on this facility or not. I don't, there are other websites that give all of the surveys that a facility has, and there will be some on there that will show that there were no citations. So this is just going to show you the ones that do have right here.
And now it was noted, I believe in the chat, somebody put in that how there was some, I can't remember where they saw it, but there was a health inspection that was dated, let me see, inspection of 4/9/21, but I thought I heard inspections are done at least annually. So can you account for that?
Yes, I can. During the pandemic, they did put some of those on hold, and they have been working to catch that up on the inspections. So some of those may not be caught up yet. Those inspections were, the annual inspections were put on hold for, gosh, probably 18 months. I mean, it's a year at least to 18 months. Those were put on hold for a while. So those are some of these, whenever you see this, especially with the pandemic that we just came through, you may not see that annually here, but that's because those annual surveys were put on hold for a period of time.
Got it. Thank you.
And they have been working very diligently to try to get all of that done and caught back up again. So, and again, as I said, they also have to do complaint inspections. So anytime there's a complaint that comes in, they have to look at that. If there's COVID outbreaks, a lot of times they'll come in and do infection control surveys on those as well. So they've had a lot on their plate the last few years, public health has, but they've been trying to get those caught up. So that may be why that you're not seeing one recently on here.
And I just want to make sure that everybody's fully aware that this is only from nursing homes, not other type of long-term care.
Correct.
Assisted living you will not find on here.
Right,
Only
absolutely.
from the nursing home information that is consistently submitted across the country. We do not have a system for that for assisted livings at this point in our country.
Right. Right. This is just for nursing homes specifically. So as we scroll down, it's going to go into the staffing. And as I go briefly over the staffing, I just want to remind everyone that it has been a difficult past 3 years with the pandemic, as well as far as staffing goes. There has been a huge amount of staff that have left healthcare. There has been a lot of staff turnover. I think there may be a bit of recovery going on right now with that, but there is still a lot of challenges out there, and facilities that never had issues with staffing in the past are experiencing that and have experienced that. So it's very difficult. So if you see a staffing rating that is above average, or much above average, or even average, that's pretty good, because it's difficult out there to get staff these days. But this is going to calculate the number of average amount of time per resident per day. And this is broken down into nurse staff hours per day, registered nurse staff hours per day, per resident day. I'm sorry, per resident per day. If I can get my words out today. LPN or LVN hours per resident per day, nurse aide hours per resident per day, and the total number of nurse staff hours per resident per day on the weekend. So that's important, because sometimes staffing is different on the weekends, as we said, and on different shifts. So these factors all go into that calculation of the star rating. And another thing that is really important to remember is that this doesn't mean that this is the only amount of time that someone is going to spend with someone in the facility, with a resident in the facility. This is just an average number. This is based on the census that is submitted by facilities for quarter. This is submitted to the state. It is also from information from the facilities on their staffing for the quarter as well. So they have to submit what their daily staffing is. They also have to submit what their daily census is to the state. And this all figures into this calculation here. But there are also other staff in the facility that is not calculated into this. You have dietary, you have housekeeping, you have laundry, you have activities, you have other people that are there and around and are going to be interacting. So this isn't an absolute when you see this, that someone's only going to spend an hour and 39 minutes a day. That doesn't necessarily mean that whenever you look at that. But again, you also want to look over here at these averages, and this is going to tell you what the national average is and the state average is whenever you're looking at these things. And this will give you a better idea of what you're looking at, if this home is different than most other homes in the state of Illinois or in the nation. And staffing has been a crisis, not just in the state of Illinois. I think I should bring that out. I mean, this is all over the country and all over the world. There has been a massive amount of staffing issues that are out there. So this will go into to that. And then the staff turnover rate. This is how many nursing staff left the facility within a year's time. And that breaks it down into registered nurse staff turnover and the number of administrators who have left the nursing home in the past year as well. And that goes into, that all goes into the star rating for staffing. Does anyone have any questions over this section?
Well, this is really good information, because staffing is such a concern at our meetings all the time. It always gets brought up how this is such an issue. So this would really help me make that educated decision, and that turnover piece can be extremely important as well when I'm making that choice. So it's wonderful to see that they have this on this site.
Right. And it's nice to look for continuity of care. We talk about that whenever you have those long-term staff, or you see those low staff turnover rates. That's good, because you know that they've been there for a long time or for a while, and they're familiar with those residents. So I know we're running short on. I'm sorry, go ahead.
And if I'm experiencing this, if I live in a long-term care facility and the staff is turning over, I could say to the facility, why don't you contact Telegen, because this is something that they're working with. They could really help you with this, because I want to have consistent staff working here.
Yes, absolutely.
I think that's something I can feel very empowered to do.
Yes, absolutely. And whenever you go, I mean, if you're living in a long-term care facility or you're looking and you do see their staffing ratings are low, when you go ask that facility, what are they doing to recruit staff? What are they doing to retain their staff? What kind of recruitment efforts are out there, and what are they, what kind of things do they have in place to ensure retention of the staff that they already have, that they don't lose them? So those are, will take you back over to that nursing home checklist that you can look at, and when you take that with you, and you can ask those kind of questions. So I know we're running out of time, Lee, but I want to go over quickly quality measures, because this is a huge piece of the, there's a lot of information here that goes into this quality measure rating. So I want to briefly go over that if we can, and just give you a little bit of idea about this. Quality measures, the facility does assessments on every resident that is admitted to the facility. They gather information, and this these assessments are submitted to CMS, and this gives CMS a picture of the residents' needs and the care that they are receiving. The information from these assessments is where the quality measures information comes from. So in this section there, you're going to see 3 different star ratings. And to look at this a little bit closer, I'm going to click up here on Frankfurt Terrace because I want to look at this just a little bit closer for you guys and show you a little bit more about this, because up here there are links about the quality measures that you can click on, and it will show you, find out why the short stay measures are important, find out why the long stay measures are important, get the current data, as well as to learn more about them and what they are, and why they're so important. So these are good links for you to click on and check that out. But in that quality measure rating, it entails a calculation that includes the short-term quality measures and the long-term quality measures. As we see, this one doesn't have data here, and there was not enough data available to calculate that. But I want to talk about the short stay quality measures just briefly. Now, short stay quality measures are quality measures that pertain to those residents who are in the facility from 1 day to 100 days. Those are short stay residents, and we look at the quality measures for those residents in this section here. The long stay are for those residents who are in the facility 101 days or longer. So when we open this up and we look at this and we go down here, you're going to see this 9 over here, like I told you. And we were talking about why is there not information available sometimes. And it says here the number of residents or resident stays was too small to report. So that's why there is no information available here. But again, call the facility to discuss this quality measure. There are 11 out of 18 quality measures that are out of the most 3 recent quarters. That is where they get the data that goes into the quality measures here. And I'm not going to go, like I said, into a lot of detail on this. You can scroll down it, and I'm going to go down here to this long stay, because this is going to have some numbers here that you can actually look at. This is going to talk about the number of hospitalizations. These are the numbers that go back to the hospital. Then within 30 days, the number of outpatient emergency room visits. These are the things you want to look at. You're going to look at this as compared to your national and state averages as well. This is going to give you more information on what is going on in those facilities. This one talks about long stay residents, the percentage of long stay residents who got an antipsychotic medication. And if you look, you can see this is a really big number compared to the national and state averages. So that's something you're going to want to look at really, really close when you look at
I
these.
think you could accommodate for some of this is because for the short stay, they said they didn't have any physical therapy at minutes. So there is no physical therapist on staff. And this particular facility
Mhm.
works those mostly with mental health issues. That's why so many people are on an antipsychotic. So those are the types of things you have to be critical about how you think about this stuff.
Absolutely, absolutely. And like I said, this is going to go into different areas that you can look into more because we really don't have time. We're running out of time, and I want to save some more time for questions. But this is looking at urinary tract infections, the residents who had a catheter that were left in their bladder, whose ability to move independently worsened. It talks about pressure ulcers. Didn't have any available on that. Also, falls with major injury. That would be something like a fracture or maybe a laceration or something like that. So I just wanted to go over that because I didn't want to leave this section out of the presentation because it's really important and there's a lot of information here. And a lot of good information for you to really dig into and look at. And let me go back here to our
And
comparison.
Carolyn, I'll just interrupt for one second. Second.
Second.
Can't get that out. If people cannot stay for this, I don't want you to rush through this because I do think this is material is important. People, you can feel free to leave, but remember it's on YouTube. So just pick it up after like the hour mark. You could pick up this presentation on YouTube and you could hear the rest of what Carolyn is saying, as long as it's okay with you, Carolyn, that you
Absolutely. Yes, absolutely. And again, if you are a facility, reach out to Telegen if you have questions about the 5-star and the quality measures or staffing or health inspections. And I think we maybe some of my colleagues have dropped that information into the chat, and you can connect with us there as well.
Hey Lee, this is Kelly. How soon will it be on YouTube?
I will put it up on YouTube. It usually takes a couple of hours for the material to get down, to go through the cloud and get to me. I don't know why, but it does. And so it will be up there by tomorrow.
Thank you.
Well, and Lee, before people start dropping out, could you give us a plug for our next meeting?
Absolutely. Our next meeting, we're going to actually have Eric Parker, who is a lawyer who deals with long-term care nursing home contracts. So we're going to be talking about what you should know in going into a long-term care facility and what you should be looking at in that contract. And what you can do and what you can't do, what you should be signing, what you shouldn't be signing. So we're going to be having a conversation around that. So that should be another really great conversation. So please do join us for that. Thank you, Stephen. And that will be on April. Always get me with the date. April 11th. So now that we've interrupted you enough, if anybody does have any questions, please do continue to shout out those questions.
Yes. And that's what I was going to ask. Does anyone have any questions? I know we're, like I said, we're short on time, but I'm willing to stay and answer questions. And I think some of my colleagues will be able to stay on as well, and we can answer any questions that you have. Anything about quality measures.
I'm sorry that you had to race through those, but I want to encourage everybody to really take a look at those and to really process through what those mean, so that they can. That is such an important place to get educated on what the care could look like you said, pressure ulcers.
Yes.
Isn't pain one of those measures?
Yes, I believe it is. There are, I don't think it's figured into this part of it, but yes, antipsychotic medications, pressure ulcers or pressure injuries, residents, short stay residents who improve their ability to move on their own, their flu and pneumonia vaccinations. That's something important to look and see if they're making sure that all the residents get their flu and pneumonia vaccinations if that's what they want. Percentage of residents whose medications were reviewed and received follow-up care when medication issues were identified. Percentage of skilled nursing facility residents who experienced one or more falls with injury during their stay. The ones whose functional abilities were assessed and goals were included in their treatment plan. The percentage of residents who are at or above an expected ability to care for themselves at discharge. That's really important. We want to make sure if we have people that are just going for short-term rehab, if they're able to care for themselves, and if they've are back to at least where they were when they came in, or better. We really want them better when they leave the facility. So you can scroll down and you can look at all these, and this, and as you said, Lee, this can give you a good idea of what is going on in these facilities and what kind of care there is. But again, I want to reiterate, and I can't, and this is a wonderful site. This is a great site to get lots of information. But again, do not replace this with, if you can at all possible, go to visit those facilities. A facility can look one way on the computer or on the website, and then when you go there, it may have a totally different feel. So, and everyone is different. We know all of us have different personalities and different likes and dislikes. So that's why it's important to actually go and visit yourself and see if this is suitable, if this is what you want for yourself or for your loved one.
So
Yeah,
if I-
you know, I have I've said to people before, you hate to look at this as like a purchase, but it is. This is one of the most important purchase decisions you're ever going
Absolutely.
to make in life. If I was looking for a new car, believe me, I get on the internet first and I do my research and I compare car against car after car. But no one's ever telling me this is the car that you need to buy, because then I go and I look at the car. I drive the car. I see how that feels for me. I see what works well for me, what doesn't work well for me, because it's about me. And that's the same sort of a thing, except this is much more important than a car, because this is
Absolutely. This is like buying a home.
Even
And
more
it
than
is
that. I mean, this is
kind of,
my
so to
life.
speak. Yeah,
Right.
it's big. So
Yeah,
you really want to do the research into it, and you want to go look, and you want to go try it out. You want to go get a feel. And I can't reiterate this enough. Go, you can go for your tour and do all of that, but also go on a time when you're not expected. That's when you're really going to really get a good feel as
Great.
well.
Stephen, did you have a question or
Yeah,
comment?
well, I'd comment. I would go even a step further than just visiting. Go and volunteer.
Oh, that's a great
Because
idea.
if you're just taking a tour, you're going to see all the nice things.
Absolutely, yeah.
But if you go and volunteer at one or two nursing homes, you are going to see some of the nitty gritty. You're going to get to know the people there, and really get an idea of what that nursing home is like,
Absolutely.
for good or for bad.
Yes. And
Yes.
it is ironic. You find that some people, like I'll talk to in my own community, I'll talk to one person that I bump into on the street and they'll say, oh, my father's at this place and he loves it. And then I'll talk to another neighbor and they're like, oh, my mother is here and she hates it. And it's the same place.
Yeah.
So it just goes to tell you how individualized that can be for a person.
Yes. Absolutely.
And to visit, if you go to this site, the information does get updated. How frequently does this information get updated, Carolyn?
I believe it is quarterly that this information on here is updated.
Okay, so it gets updated quarterly and it does run behind a little bit. So this is not like a data for right now, right? This would be for the last 3 months worth of data.
Right. Yeah. And it, when you look, it will tell you when this information was last updated. I believe if I go, let me go up here, it will show you. Let's see. Well, maybe not there. I can't remember where that's at. It does tell on the website when this information was last updated.
Okay.
And I have to look because I have
But it's
forgotten
not
where
like a
that
year
is
ago data.
located.
It wasn't a year ago. It was within the last.
No. It's been pretty recent. Yes. Oh,
there we
right
go.
here at the very bottom, data last updated on February 22nd, 2023. And some of this will probably update monthly, depending on, like those quality measures, those are looking at quarters. So those don't update as frequently. So that looks back on quarters. So that's where that variation is in those updates.
So this is, I mean, this information is just so important for me to make that empowered care choice. I really, I know whenever I get that phone call from somebody, I always refer them to this site. And just the way you talked us through it today, I learned a lot about the codes and the hands and the little information on the side of the triangle. That's all very, very helpful information to be able to make that empowered care choice. And that's what we're all about here, is being empowered with the care that we want for ourselves and for our loved ones. So thank you so much.
Absolutely. Oh, you're welcome. Nursing homes they are very highly regulated. They're the most regulated business in the healthcare industry, and the information from that is out here for you to see. It's here. It's available. Make good use of it. If you're looking to put someone in a facility. Whenever I was an administrator, I'm going to digress for just a second, if you'll indulge me for a moment. And this wasn't just me. This was other administrators that I worked under too. I worked under some very good leadership for years before I stepped into those roles myself. But one of the things that I learned was whenever someone calls and they want to come and they want to have a tour, don't necessarily give them a date and time. Tell them to come in whenever. I'm not going to tell you when to come visit. You pick a date, you pick a time, you show up. We're gonna show you around. We're gonna give you that information. Come surprise us. Check us out. See what we have to offer. And those are the kind of things that you want to look for. The willingness, the openness of the facility. To welcome you at any given time when you want to come in and check it out.
And Steve, I think we had another question come through the chat.
Yeah, the question is, how is data affected when a nursing home changes names?
That is a good question, and I'm going to defer that. I don't know, Lisa, are you on?
I don't know if Lisa's on. This is Nell.
Nell.
So, yeah, hi. So with nursing homes, usually when there's a buyout, every nursing home that is CMS certified has what we call a CMS certification number. And that number usually stays. So their history follows them. It attaches to that CMS certification number. Now, if there is a change where they go through the recertification process, then it starts as a whole new entity. So a part of this, as Carolyn was stating, you have to have 3 years of surveys before you enter this system because it's weighted. The first year is the heaviest weighted. So a new facility has to have 3 cycles, which is 3 annual certifications to enter this system. So the whole process begins with that survey. So as Carolyn was saying, some of the data updates monthly, but your overall star rating will update after your annual survey, which of course can be different for every facility. But that's what starts the overall star rating change, is that annual survey. They can have a complaint survey that will be posted, but it's not going to change their overall until that annual survey happens. Hopefully that answered the question.
Yes, thank you. Thank you. Well, with that, I'm going to end the recording, but sometimes we do have people. I'm going to go ahead. Thank you. I want to just publicly thank you. Thank you so much for bringing this information to us today. It was really, really important information, and I want to encourage everybody to use those links as well. And I'll take the links and I will put them on an information sheet and attach it to the program description on our website so that people can also go to the Ombudsman page website and be able to access those links. So I will do that for everybody. So know that you can just go to the Ombudsman page website, which Stephen put in at the beginning of the session. I'm going to go ahead and stop the recording right now, but we